I think there's still a lot of fear. There's still a lot of grief, desperation levels. We're not seeing as much as was before, but still finding a bed if you need one or not, finding places that have adequate stock of oxygen, that still remains a concern.
Mm.
So it's not as bad as it was 2 to 3 weeks ago. Definitely it's improving, but we're still not out
Mm.
of the woods, I would say that.
I understand people across all different age groups have been affected by this crisis, but in
Mhm.
particular, young people and children. How have children been affected in this second wave?
Mhm. So, we don't really have the evidence that the numbers of children or the proportion of children being affected has gone up when it comes to directly being affected by COVID-19. But as the numbers have swollen, the proportion means that there are more children and young people and even infants who have been affected.
Mm.
Fortunately, in most cases, they are affected in a mild or moderate way and not really requiring the type of hospitalization we see for adults. And for children, of course, the concern is, the knock-on effect that the pandemic is having. The fact that their caregivers are being affected, that livelihoods are being affected. For school-going children, the schools have been closed for over a year,
Mm.
and children's daily routine is disrupted. And what we've seen in the pandemic really is that the stress levels that families and adults are facing, it is transmitted to children and young people especially, and they are facing that psychological trauma, especially when it comes to children who have lost their primary caregiver, children who at times both parents have been or all caregivers have been in hospital. That's a really added stress to children. So there are many knock-on effects that we see children are being affected more by.
So, are we seeing more children being orphaned during this crisis and more children being involved in illegal adoptions because of parents dying because of the crisis?
So what we're seeing is that definitely more children are being orphaned. We still don't have exact numbers, and the state governments are working really to see how they can register them adequately, how they can first get the reports coming in, and the whole worry and concern around illegal adoption and trafficking of children started really when in the social media we started picking up on these children's plight being put out there, and that really makes children vulnerable. So the Ministry of Women and Child Development have really come down very strongly to make people aware of what measures are in place, what every citizen's role is in reporting when they know of a child who is without parental care, and what other social measures can be put in place for these children who do find themselves suddenly very vulnerable. So it's really about recognizing that the threat is real, that we have to be tracking such children and really activating the systems to support them and protect them at this grave
Mm.
time.
You've previously said that COVID-19 is a child's rights crisis. Can you explain more about that?
So it's really been the face of the crisis has been an adult face. So the knock-on effect it has on children, or the silent emergency that children are facing, is something that we have been really working hard to put out there to make sure people don't forget that children are being affected gravely by this crisis. And when we look at child rights, we're talking about not just the right to survival, but the right to adequate nutrition, um, to opportunities to learn, for them to be protected from abuse, exploitation, for them to have, the right to socialize and play and interact. So when you look at all rights of children, we do see those rights are constrained at the moment because of the pandemic itself and the containment measures that are needed. So it's very important that we not lose track of it, because the effect it'll have on children can be long lasting. And we do need to look at what solutions we can put in place. So it's not just to ring the alarm, but it's also to come forward with solutions of how we can keep children in learning, how we can address the psychosocial barriers that they are facing. How do we put in place a social protection system that helps them and their family? And we do know that there is going to be the knock on economic effect, especially for the poorest population, especially for the daily wage earners who are in a very constrained environment. And we do need to pay special attention to that.